Well, welcome back. The latest victims of the sequester, our nation's wounded warriors. Several employees at Walter Reed National Medical Center have received furlough notices. So what does that mean for veterans in need of medical care?
Joining us from Washington, D.C. is retired United States Marine Corps Gunnery Sergeant Jessie Jane Duff, who is also a member of Concerned Veterans for America. Good morning, Sergeant.
Good morning, and how are you today?
I'm fine, thank you. Nice to see you. Tell us about this. It sounds disturbing on the face that the people who need the services most in our military are going to be deprived of the workers, the employees, the people to help them at the Walter Reed military facility. Tell us.
Right. This is very disturbing because I don't have a lot of information that's been released right now, so it makes it very suspicious to me. Has this been released to get the public all stirred up that military is being affected and the warriors aren't going to receive their medical treatment? I mean, is this like the TSA incident where people were going to be backlogged at the airports and not be able to get on the flights? Is this a covert ops plan to get us more dependent upon the government? You know, in this recent years, we start to wonder what is the agenda behind everything, and I am very curious myself.
As a concerned veteran, of course, as working for the Concerned Veterans of America, you have to have identified all of the potential problems and pitfalls and shortfalls where the government has let veterans down, and this seems it's just adding to that list.
This is just another long list. You know, for example, with the VA right now, we have a 1 million veteran backlog waiting on their medical claims with the Veterans Administration.
Right.
So if Walter Reed is going to start cutting medical support for our warriors, it is appalling. We have numerous other agencies and arenas we can cut before we affect the medical care of our warriors who have put their lives and their health and everything on the line to defend this country.
Well, what do you think the issue is, Sergeant? Do you think it's the Obama administration trying to prove that there's pain in terms of the sequester cuts? Or is there a lack of interest and a lack of caring about veterans as exposed by the fact that 20,000 veterans are dying each year waiting for the benefits they never got?
Yes, 20,000 veterans do die a year waiting on the VA to provide their medical claims. And people can get more information on our website at concernedveteransforamerica.org. But what's going on is very curious because we don't know if this is a ploy by the administration to get the public riled up, to want more government support, more government assistance, and have us think, oh, we need more. Or is it simply a simple furlough that's going to cut administrative staff or people that have no involvement with the veterans' medical care? And there are cuts that our government can make to run more efficiently.
Yeah.
You know, the MEADS program's one, you know, missile program, $13 billion that have gone down the toilet in the next 10 years on a dead program that's never going to go anywhere.
Yeah, well, Congress and the administration designed this to be painful, and you can't get more painful than having to harm our nation's veterans. Gunnery Sergeant Jessie Jane Duff, great seeing you this morning. Thanks for
well, thank you so much for having me.
Semper Fi, Sarge.
Semper Fi.
Coming up here on the show, can't get your